Good morning, everyone. Thank you for joining us today for our second webinar of the year. It is so very exciting to be in front of you again today. Today, we will present an employer's guide to avoid out-of-network charges. My name is Melina Cambizzi. I'm the Senior Vice President of Strategic Marketing and Business Development here at the Alliance. And we're excited to have more than 100 people registered for today's webinar. Some housekeeping items to begin. You're all in mute mode, but we still want to hear from you. So please use the chat feature to ask your questions and send us your comments. I am so thrilled that some of you are already connecting with us. So welcome, thank you everybody. Please also note the handouts from today's event will be made available on the events page on our website, and we will email a link to all attendees next week. You can also access them by clicking on the handouts drop-down in the control panel here at the GoToWebinar. I would like to thank our sponsors first and foremost. Thank you, sponsors. Thank you, National Cooperative RX and Delta Dental. We tremendously appreciate your continued support for this great programming for our employers. So let me introduce our topic today. I wanted to say just a few words before Deb joins us. About why we think at the Alliance this topic is very important for all of us. Out-of-network spend is often employers' largest healthcare spend. So we want to bring that spend in-network whenever possible. Our research indicates that it can be 15% of total healthcare spend for our employers. Today, we're going to help identify opportunities of how to avoid this spend and talk about the importance of data and cost transparency. Out-of-network spend is really a lose-lose situation. It's lose-lose-lose situation. It's bad for employers and employees as they're paying more for care than they would if the spend was in-network. It is also bad for our providers as it causes potentially mistrust with patients and potentially more caution from patients on care options as they may not be able to afford it. The Alliance considers it as part of our responsibility to be looking at your data, and we do so on a quarterly basis to help you manage your self-funded plans. And because transparency is a very important topic in healthcare right now, also at the government level, at the state government and federal government levels, where there are a lot of new regulations that are going into effect, you may be hearing much more about this topic. And specifically that employers have a fiduciary responsibility as plan sponsors of their self-funded plans to manage their health plans appropriately, which is why you need access to this kind of data and to also be looking at it regularly. So thankfully the Alliance can provide this, and as always, we love having your back. So without further ado, I would like to introduce today's speaker, the Alliance's own Deb Kunferman, who will be discussing how to avoid out-of-network charges. We know this topic is important not only to you, our employer members, but also to your consultants and advisors, and also to your employees. A few words about Deb, a dear colleague, a dear friend. Deb joined the Alliance in 2013, and today she serves as VP of Provider Relations and Contracting, where she leads the team responsible for constructing a provider network that brings value to employer healthcare purchasing. And she also provides direction and oversight of our provider network development strategies, including maintaining and growing provider partnerships. And she will talk about some of these things here today with us. Deb has previously served as CEO at Cumberland Memorial Hospital, where she oversaw the fiscal budget, 26 departments, and 285 employees. Other roles include her being the CEO at Oakleaf Surgical Hospital and Executive Director for Valley Health Plan, an insurer in Eau Claire, Wisconsin. Deb lives and plays and works in Eau Claire. She's a great community leader. She has an incredible resume, but one of the things that had my attention, she was elected as the first president for the Kiwanis Club, the first female president in their 42-year of history. So I'm especially proud of that. So Deb, without further ado, I will turn this over to you.
Wonderful. Thank you for the kind words and the kind introduction, Melina. It's great to have all of you here today joining us for a conversation. And really our goal is to help equip you with a guide to avoid out-of-network charges. So let's take a few minutes to level set, because we're going to be using some words and phrases throughout the conversation and dialogue today, and we want to make sure that everyone is on the same understanding of what they mean. So the title of the webinar today is Avoiding Out-of-Network Charges. Well, what does out-of-network charges really mean? Out-of-network charges means that the alliance does not have a contract with that particular provider. And why that becomes important is because then that provider is not a part of your health plan's provider network. Additionally, that provider, out-of-network provider, then can do what's called balance billing. And what does balance billing mean? So balance billing is really important because it's not a good thing for your staff and your employees. Balance billing means that the out-of-network provider can hold the patient, your staff member, responsible for the difference between the amount that the provider charges and the amount that the health plan allows for that service. And here's the big difference, is that in-plan providers or in-network providers can't balance bill. That's what we want to focus on today, is saving costs and protecting you as the employer as well as your employees. Another key phrase that we're going to be talking about today is something called surprise billing. You may have heard about this. There's been a lot of visibility, and there's federal law now that we'll be talking about later that is centered around surprise billing. Surprise billing, it means that the patient did everything right. They did their research. They actually went to an in-network hospital and later found out that one or more of the providers who treated them at that in-network hospital was out of network. This is not okay, and that's why there's now federal legislation to protect both employers as well as employees, and we'll be talking about that more. As the slide represents, this is pretty prevalent and happens fairly often. Across the US, 1 in 5 Americans have experienced this type of a situation, and it's not okay. So let me give you a quick example of how that might happen. So let's say I know that UW Health is in our provider network, and I schedule my upcoming surgical procedure at UW Health. I go and I have the surgical procedure, and a month later, I receive a very large balance bill or an invoice from the anesthesiologist stating that the anesthesiologist that was utilized during my care was out of network. That's what surprise billing is. So we've talked now about the terms and some key phrases, so let's get the conversation started about how we can help you with all of this. The Alliance has a process. So first off, I wanted to tell you that the Alliance is pretty proud of our contracting staff. We have 4 contractors with vast experience and knowledge negotiating contracts with providers on your behalf. Most all of our contractors have had experience negotiating contracts from the payer perspective, but also have worked on the provider side as well. So what we do is we, the contractors, we identify out-of-network providers on a very regular basis. And how we do that is with claims experience and claims history. So at least quarterly, we review services that occurred at out-of-network providers. And then what we do as contractors is we determine if those providers are viable to contract with or to add them to our network. What I want to say, and what's really important, is that just because a provider shows up on an out-of-network list does not mean that we will automatically extend a contract with that particular provider. We have a very extensive and thorough vetting process that we go through to determine if a provider is viable to add to our network, because we know that we're committing them, that provider, to you, the employer, to pay those services at the in-network benefit level. Let me give you some examples of what we use in our vetting process. Providers have to agree to some pretty stringent rules and requirements to contract with the Alliance. One of them is a longer contract period. So what do I mean by that? It means that the provider must remain in the network for at least 2 years without the ability to leave the network. So then you might ask yourself, well, after 2 years, then do they leave? And the answer is no. Our contracts are evergreen, and what that means is that the contract will automatically renew unless either party, meaning the Alliance or the provider, chooses to end the relationship. One of the things I also wanted to point out then about ending relationships is that the Alliance is pretty proud. We have long-standing provider relationships. It happens very rarely that a provider will terminate or that the Alliance will terminate a provider because we're doing our vetting up front. However, it does happen. You know, one example with a larger health system, we've married and divorced actually several times with one particularly large health system, and now we've been together and married again for several years, and it's going very well. So it does happen. It's very infrequent that that happens. Another piece of how we vet the process is what is really important for us to protect employers is that we get providers contracted using Medicare as a basis for reimbursement. Why that's really important is because it protects employers for large increases in providers' charges. So all in all, I think Melina at the beginning, she alluded to the fact that approximately or about 15% of all care is rendered at out-of-network providers. What I wanted to point out, and this slide points out, is that through our processes, in the last 12 months, the Alliance has added 174 new providers to the network. Something else that we're really proud of is that 116 of those providers are behavioral health providers. This has been brought to our attention regularly by employers about access issues with behavioral health providers, and it is one of the areas that we continue to focus on for expansion and addition to the network to try to combat the access issues that employers are experiencing. So we are doing our best to make sure that we are adding the right providers to the network on your behalf. Once a provider is added to the network, there are protections in our contracts that state that an in-network provider must refer to other in-network providers. So this is important because it's helping patients to stay in network. It is a requirement of our contracts, and it is a protection for enrollees that if you ever need to go outside of the four walls of the in-network physician that you're currently seeing, that physician gives you options to go to other providers, and that at least one of those options is another in-network provider. You know, if this isn't happening with your plan provider or your in-network provider, please let us know, because then what we can do as contractors is work with that in-network provider and make sure that they have the tools and the resources that they need to ensure that they are giving you options of other in-network provider choices. At the beginning of the presentation, we talked about surprise billing. And I want to go back and describe again what exactly surprise billing is. So to recap that, surprise billing is a large unanticipated balance at an in-network hospital. So it means, for example, if I went to an in-network hospital and one or more of the providers that rendered my care at that in-network facility turned out to be out of network, and it leaves me with large unanticipated balances. As I mentioned earlier, this has been a focus for legislation. And the good news is that a federal law was passed effective this year, January 1st of this year, and it's called the No Surprises Act. It is a federal legislation that protects both employees, patients, as well as employers. So let's talk about how that all works. How does it protect patients first off? So what the law does is it protects patients so that any patient should never have to share more cost than if they would have had that same exact service from an in-network provider. So what I mean by that is if there were deductibles, coinsurance, or copay, that those coverage levels for the patient have to be the same as if that service had been in-network. So the patient is protected from that sense in terms of their out-of-pocket expenses. The employer is also protected because when the claims are paid for those out-of-network services, they are priced at a usual and customary like reimbursement methodology, and the providers, because of the law, cannot balance bill. So while all of these protections are in place and this federal legislation is in place, there's also some rules and regulations around the hospitals and the ambulatory surgery centers where when a patient goes there for services, they have to advise patients of these rights, meaning the right that the patient cannot be balance billed. The other thing I wanted to mention is that even though there's federal legislation, we believe that it is still best if we, the Alliance, have a direct contract and bring these out-of-network providers to an in-network status. We don't want to have to rely on this bill and rely on the fact that all these processes go smoothly with the federal law. We would prefer that we move these providers to in-network through our processes that we talked about. So what will happen is we will identify these providers on our list that we talked about earlier with our process of identification. However, if you happen to be aware of one of these situations, bring it to our attention through our provider nomination process, which we'll talk about in a little bit. So far through this discussion, we've talked about processes that the Alliance has in place to protect you as an employer, as well as employees. We've also talked about federal legislation that protects you. But now what we wanted to talk about is how we can equip you with tools and resources that can help you to avoid out-of-network charges. Here's a quick list on this particular slide that we're going to talk through in a little bit more greater detail as we go through each one of these. So first and foremost, we want to make sure that employees are educated and that they are provided with the tools and resources that they need to make the best decisions possible. Again, Melina talked about this at the beginning. I've talked about it. The more that we can keep care in network, it means lower costs and higher coverage levels for the patient and your employees. So the Alliance has developed some flyers that you can use, and we've developed them specifically for this webinar. They will be made available through this webinar as well as after the webinar on our website. They will also be made available in several different languages for you so that you can use them with your employees and staff. So I wanted to share a couple of tips from one of these flyers. The flyer titled How to Avoid Out-of-Network Charges displayed on the slide, there's a couple of things to call out. One of them is when we would suggest that whenever you're going to a provider visit to have services done, and they're going to be fairly extensive, maybe not just an office visit, but maybe it's a procedure, we would encourage you to ask the provider for a cost estimate, meaning how much will this service cost you as a patient. Additionally, then, after the visit, what we strongly recommend is then matching up that estimated cost with what occurred in terms of the invoice that you might receive from that particular provider, as well as how your health plan paid for that service, and making sure all of that matches up and appears to be correct. What I want to walk through next on the next slide is the Find a Doctor, because that's the next piece about employee education and to encourage your staff to use the Find a Doctor application to find in-network providers. So Find a Doctor has a mobile app. Also, it can be accessed on our website. We've provided the link here on the slide. You can also find it through many different search functions on our particular Alliance website. Once you get to the Find a Doctor on the website, it will prompt you to enter your location. So for example, you can enter your zip code. Once you enter your location, it will then ask you or prompt you for your employer name. And then you can enter your employer name and click on that. And finally, it gets you then to the appropriate search function. Once you get to the search function, you can search for providers by name, specialty, facility name, or facility type. Again, we really encourage you to strongly talk to your staff through employer benefit meetings, employer fairs, educate them on these tools and resources, and repetitive discussions with staff is necessary so that they get it. Once a year might not be enough. We'd strongly encourage you to continually do education to staff to encourage them to use in-network providers and provide them with these tools and resources. What we talked about earlier was the ability for you to nominate a provider. So let's say you went to the Find a Doctor and you didn't find the practitioner you were looking for. They're not in our network. So what you can do then is we encourage you to nominate a provider. Here's how you can do that. You go to the Alliance website, you're going to click on the I am search function and then go down to and click on an employee or family member. At the bottom of that screen on the right, you'll find the square that's referenced on the slide here that indicates not finding your preferred provider. And once you click on that, you can enter the information and recommend a provider. What happens with that is we take every single one of those requests seriously. They come straight to the contractors, and that's where we begin our vetting process. One of the things you might be asking yourself is, well, how long does it take the Alliance once I request a provider to get that provider in network? And the answer really varies. That time frame can range between 1 week all the way to more than a year. I'll give you an example of this. Gunderson Health System is currently in our network. That particular relationship we worked on for about a year and a half before we moved forward and executed the contract between the Alliance and Gunderson Health System. You know, in contrast to that, there might be a sole practitioner or a chiropractor, for example, that we could get the contract done in a week. So the time frame does vary, but keep in mind, again, all of these are taken very seriously, and we look at every single one of them. So to wrap things up here, I'm going to turn it over to Melina, who's going to talk about smarter health analysis, and then we'll move on to questions.
That's good. I was able to work my computer and get my voice and my face back on the screen. Sorry for the delay. So yeah, wanted to spend just a few minutes with you all to show you how we can provide you with your data. Smarter health analysis is another way that the Alliance can help you and your brokers, advisors, consultants to help you make better healthcare decisions. Unlike other payers, the Alliance gives you access to your data. This is one of our true North Stars and our mission in changing the healthcare landscape. We're showing here a few of the analyses within the broader Smarter Health analysis. And you can see the three that we picked to just showcase here for you is an analysis of in-network, out-of-network, ER utilization, which can lead to understanding if ER is overutilized by your plan participants. Then, do we need to look at benefit design, maybe? And then also steerage recommendations. And we can look at high-value healthcare providers by your zip code or by a set of zip codes that you can provide to us by whatever mileage feels best for you. We're showing here 100 miles, but we've done the analysis for 30 miles, 50, 75, and so on. So one way, a very big way, a very important way that you can use your data is to steer your employees to high-value providers. And while we know that today's discussion, such as, for example, avoiding surprise billing, is a consumer issue, we want to make sure our employers and their advisors are looking at the data, and also that we're all listening to our patients, our employees and their families, to try to contract with the best providers that they're utilizing so we can avoid all of these issues from happening in the future. So the real end to the presentation today is a call to action. Please know your data. Please have access or ask access for your data. Our account managers are want to be meeting with you a couple times a year and take you through these analyses. We currently have approximately 100 out of our 300 employers that are utilizing these analytics and steerage recommendations and the rest of the analysis that the Alliance is providing them. But also, if there is an issue, please let us know. You may hear that an employee needs specialty care. You may hear that an employee needs specialty injectables and they have to travel a long way to receive their specialty medications. You may hear that a family member is having access issues. We want to know these things. Let our team know, and we can help find you solutions, and we do these every single day. So with that, we're going to end kind of the formal presentation and hopefully start a conversation. First and foremost, I want to thank my colleague, Deb, for your preparation today, for all the work that you do with contracting. I hope you all found this helpful. And I am going to open it up now for questions. I've been seeing that we're getting a few coming in. For those in attendance, please remember to send through questions in the chat panel. Okay, so our first question is about employee education. So I know, Deb, you touched upon employee education quite a bit today, but employers often ask, how can they properly educate their employees to seek in-network care? Not everyone has care navigation. Not everyone has the staff, the HR staff, to help employees navigate through the very complicated healthcare system. So what's the most effective way to reach employees and their spouses, their dependents, to use only in-network care?
Right, it's a great question, and Melina, you hit the nail on the head. This complex industry that we all work in it is a jungle, and it is, we work in it every day. But think about the consumer who doesn't know all of the details that we all know, and isn't involved in this every day. Of, how do we make it simple for them, and how do we create an atmosphere that we're continually educating them? I think that is the answer. And through this webinar today, one of the things that we did was we created a couple of flyers that we strongly encourage you to take use of. One of them talks about find a doctor. We want to make sure that we're giving you the tools and the resources that you can use to help your staff to determine who is in network. And then the other key message for me, I think, is constantly reinforcing those messages. It's not, we would suggest more than once a year. That's not enough. Consumers, they need to hear things several times. I myself, I need to hear things almost like 100 times, right, before it sinks in. So the more that we can continually train employees and staff, the better.
Yes, no, absolutely. I also want to remind our audience that about a month ago, we had a phenomenal webinar. Dr. Jessica Grossmeyer was wonderful in helping us, give us ideas about developing wellness programs, but also we had an enormous vast discussion with her and with employers on how to educate employees and their dependents. I think before I go on, my mind is going into tangents, but before I go on, you can access this webinar from our website. I highly, highly recommend it. But we do know that our employers know their audience, they know their plan participants, they may have a diversified ethnically or from a gender perspective workforce, and we know that often we need to reach the families. And so, as Deb said, we need to be talking not only to our employees, but also to the family members. And we can absolutely help strategize around some of these strategies. So here's another question. If an employee or their spouse needs care that's out of network, how do you choose a provider then?
Yeah, it's another great question. One of the things I will say is that the Alliance network is very vast. We have tertiary hospitals, quaternary hospitals in our network. We have every specialty covered. We get it that there are going to be instances when you wish to go out of network. What we would strongly first encourage is see what in-network options are available. So again, refer to the Find a Doctor tool. You can call our customer service lines if they can help you as well. So my first thought of action goes to let's really try to steer to in-network if we can. If you absolutely have to go to an out-of-network provider, again, I really strongly would encourage you to advise staff to get the costs, because they could be subject to very large balance billing because there's no contract. So they're open to balance billing issues and whatever the provider might charge for that service, because there is not a contract to protect anyone. Melina, do you have something to add?
No, I think we're getting so many questions, so I will keep going on, and if we need to come back, we'll find an opportunity. I am watching the time, and I think we have a little bit of time. Let's talk a little bit about steering to high value care. So our audiences, our employers, our brokers have heard us many, many times say that we strongly believe in steering to high value care. What do we mean by that, and how is that determined?
Right, so high value care, we are using our analytics in terms of cost structure, the final cost for a particular service, and we are also looking at some quality data through Leapfrog or publicly available data as well. And that is how Melina talked about that in the slide presentation with the steerage analysis and smarter health analysis reports. One of the things I also wanted to mention is that if a provider shows up on that report today, it doesn't mean necessarily that that provider might be on the report next month, or vice versa. If a provider isn't on there today and isn't a high value provider today, they could show up on a report next month. And what I mean by that is that once we sign a contract with the provider, that is not the end of it. In fact, we are constantly and continually monitoring the performance of our contracts and renegotiating them. So a provider could show up on a report next month that wasn't on there now.
Yeah, that's a great answer. Thank you, Deb. I did mention that approximately 1/3 of our employers right now are using our analytics for some type of steerage that can range from quality path. I know many in our audience know about our quality path, which is very specific quality and cost information by provider, by procedure, and they're using other means to steer as well. And what's really phenomenal is that we find when we the employers, right? When I'm saying we, it's the employers, help move market share, then we have more and more providers coming to you saying, how can we be in your analytics report? How can we be one of your high value care steerage providers? And that's kind of an incredible opportunity for your staff, you and your staff, to make changes, to introduce bundles and make changes, right?
Right, completely agree. Since we've ramped up our processes with smarter health analysis and sharing these costs and data and steering to high value providers, it has helped us to secure even better contracts. Negotiating is actually really fun. You're probably all thinking, ew, yuck. But no, it is fun because it opens up the door and it is helping us to negotiate more high value contracts on your behalf. So thank you for your steerage to high value providers.
Yeah, and as I was talking, I mentioned bundles, and wouldn't you know, we actually have a question about bundles as well. So this audience member is saying, I've heard a lot about bundles as being a cost-effective option for us, and for our employees. What types of services are typically associated with bundles, and how do I get my employees to use them?
Right, a couple of things on bundles that I'd like to make you aware of. So just because a provider offers quote unquote a bundle or a package price that is marketable to the public and they say what the price is, that does not necessarily mean it is high value. So it could be perhaps highest cost, even though it's a bundle. So just because something's a bundle doesn't mean it's necessarily high value. So that's the first thing I wanted to point out. However, with that said, the Alliance has contracts with about 10-ish providers where we do have bundle arrangements, and they are very high value bundles. And these services range from colonoscopies to many orthopedic musculoskeletal procedures, as well as imaging, MRI, CT, those types of procedures.
Yeah, and I wanted to mention as well the reason why we have chosen some of these bundles, and I know that you're ever searching and looking for the right bundles to bring to our Alliance member employers. But when we talk about bundles, primarily what we have here today is imaging, GI, and musculoskeletal, including carpal tunnel, as well as hips and knees and spine surgery and other. And the reason why we've chosen these bundles is because we know from the data, these categories is where employers spend the majority of their money. Self-funded employers tend to spend the majority of their healthcare dollars in these categories, right? So we're not only always looking for the right bundles, but we're always looking at the data to see what's coming up as a high spend procedure or service line, and then we approach it from that perspective as well.
Absolutely correct. Yes.
So here's keep having questions. Do you have any advice on how to give employees pricing information? For example, this audience member is saying, is it possible to make the record through an electronic medical record such as Epic MyChart, or is there another online tool that employers can use? And this is a complicated question, so let's tackle it, Deb, because as we said, healthcare is complicated, right?
So if I understood the question correctly, it was related to the cost of the service, and the question asked, could the patient get the cost through their medical record? Is that?
Yeah, yes, I absolutely, sorry, I didn't mean to interrupt. I just wanted to just a little bit clarify, how do we best give employees this pricing information?
Yeah, so if employees are interested in cost information, the Alliance also offers that as an option. So patients can call in to our customer service lines and we can give you a cost estimate. So that is another alternative. And we use our claims data as well as our contracts to provide that to the patient. You can also ask the provider. They should be able to give you a cost estimate. I'd be a little leery about a provider who can't give you a cost estimate on the services that you're having with that particular provider. So you could go both of those streams or paths to get the estimated cost of what the procedure or services that you intend to have done.
Thank you. So going back to bundles, because we got a bundles question as we were talking, you and I, Deb. How do we see the bundles that are put together by the Alliance? And if you don't mind, how do we find them? How do we see what are the bundles that the Alliance puts together? If you don't mind, I will start the answer to these and then please add as appropriate. So first and foremost, we try to put as much information on our website. We will be launching a new tool that will help with the different cost estimates, will actually help employers and employees on our website as well. However, we do have, at the end of the day, when you start looking at all the lines, we have hundreds of bundles and we can't just possibly put everything on the website. So another way that employers are actually utilizing right now is they call us, they call our account management staff, and we can provide you with very detailed information on all of our bundles. We also know that many employers are using care navigation. So we work with care navigation firms and we exchange data, your specific employer data, and the bundle so that we can help them guide your plan participants to high value providers. Something to add to this, Deb?
I think you hit it. The other thing is then that the bundles that are really high value will show up on your reports that you're getting, your Smarter Health Analysis reports that you're getting from the Alliance.
Absolutely, yes. How could I forget that? Yes, you're right. So here's another question that I'm gonna tackle, and I'm not gonna pass it over to Deb. Does the Alliance offer a PBM contract, and with whom? So the Alliance does not offer a PBM contract. We are a cooperative of 300 employers who work together as one voice to get medical type contracts. However, having said that, I thanked National Cooperative RX in the beginning of the presentation. I do that every single webinar. National Cooperative RX is a sister coalition. It was developed through the Alliance employers. And National Cooperative RX is actually a watchdog for your PBM contracts. So they use CVS as their PBM, but they have incredibly powerful contracts that return to employers the rebates, and they watch the language of the contracts, and they can actually help employers look at their current PBM contracts and give them advice. So of course, at the end of the day, your TPA and your broker will be best to advise you on PBM contracts, but I strongly recommend, I'm also serving as of the beginning of the year on the National Cooperative RX board. It's a not-for-profit cooperative, and I am so thoroughly impressed by the work they're doing. So I would highly recommend you ask your brokers about them. So then what is a typical Medicare reimbursement? Oh, this is a great question. You'll love this, Deb. What is a typical Medicare reimbursement percentage for common procedures? 140, 160, 200% of Medicare. What do we typically look at?
Right. I wish the answer were that simple, that there were one percentage for a typical. So What I will speak to specifically is, let's say, office visits. Medicare going into 2022, and actually last year as well, they monkeyed around, so to speak, with their allowance for typical, what I refer to as office visits. In the medical world, they're called evaluation and management, but we call them office visits. And they greatly increased. In fact, they increased their rates, Medicare rates, by up to 40%. So this is what often happens with Medicare, is they reevaluate certain categories of services or a specific service, and they had made a decision that office visits were undervalued. And so they did adjust those. And so when something like that happens, and the reason I'm bringing this up is then their reevaluation to that level, because that was a substantial increase. And when our contracts are based as a multiplier of Medicare's allowed, it impacts then our contract. So we had to readjust a little bit because there was such a substantial increase. It really impacted. So for example, now for evaluation and management services, our out the door rate, so to speak, what we attempt to get for office visits now in today's world is 150% of Medicare's rate. So that's a very specific example, but as I said, there are so many categories of services. In fact, there are, I believe, 26,000 medical codes that can be reported by a provider, and those codes can be categorized into larger categories such as pathology or radiology, and each of those categories we do look at differently because of the way of the Medicare evaluation and valuation of them. So each has a different out the door rate. However, I just wanted to share with you one example, which was office visits.
Yeah, and I also would like to mention, although I'm going to mention this in a few minutes again, I want to mention that on May 23rd, we're going to have our spring symposium, and actually RAND will be presenting their latest study. They're working diligently to finalize everything. They are looking at the cost of care in various states, including Wisconsin and Illinois, as a percentage of Medicare. Also, we're going to get to hear from the CEO of the Indiana's Employers Forum, where she is helping employers utilize this information as well. Lastly, I also want to mention that we actually do have this information. So if you would like to know percentages of Medicare that you're paying, meaning your specific utilization, your specific data by service lines, by providers, we are happy to work with you on that as well. And it goes back to steerage. We look at the percent, and that's how we internally look at pricing. It's not just the absolute price, but what is the percentage of Medicare, and how do we help steer to where quality is good, care is good, and cost is more affordable. I'm not going to say cost is good, but cost is more affordable. So here's a question that I know I'm going to give an example because we do have a couple minutes, but I'm going to turn it to you first, Deb. Does the Alliance reduce drug spend under the medical plan, J-codes, I assume, by optimizing site of care pricing?
Right. So to answer that, any drugs that are not billed through the pharmacy benefit plan that get billed through the provider, I'm going to say hospital or doctor's office, and typically these are J codes, as Melina mentioned. Yes, site of service does actually matter. So our reimbursement methodology is based again off of Medicare. Medicare does have a different fee schedule, what we refer to as services that are done in a hospital setting versus, I'm going to say, in a non-hospital setting. And you know, some perhaps of the drug services have a different pricing. Many of our contracts also use Medicare has a very specific fee schedule with relative to drugs that we also use. So there are various methodologies for drugs, but in general, yeah, site of service does matter, even if it's not drug related. So for example, if you see your specialist in a hospital setting versus in a clinic setting, the cost actually is different, because when your specialist is seeing you in a hospital setting, our allowed amount for that service and our reimbursement rate for that service is very different, because that specialist isn't using their own overhead. They don't have to pay for staff for that particular service. You don't have to check in with their receptionist at their clinic. So that's why our reimbursement is different, and it does matter for place of service.
Yeah,
I got the answer of that question.
Yeah, I like your answer a lot, and maybe we'll get additional questions as we're speaking. But I want to bring an example, because we actually have real life examples of the work that we do with employers. So a few years ago, an employer came to us. They had a patient, they had an employee that needed infusion of Humira. And their provider, their specialist, sent them to a hospital system that was, I believe, about 45 minutes away from her home. And she received her first infusion, and at the same time, the hospital gave her, the providers gave her Benadryl to help her. And then she had to get in her car and drive 45 minutes back to her work or her home. And so she went, before it even became apparent on our data, she actually went to her HR, to the HR director of this company, and said, don't I have a different solution? So the HR person called us, the HR professional called us, and we worked, first of all, we identified home care for her, so home infusion. And then we actually worked, because we have a wonderful nurse internally. She actually worked here at the Alliance. I mean, she actually worked with the provider's office to make certain, because this infusion needed to be on a monthly basis, to make certain that the next order from the provider's office went to this home infusion center. And let me, kind of the mind-boggling, of course, the very first thing that we care about is the safety of our patients and the experience of our patients, because we're all patients and we all want to have a good experience. But here's the mind-boggling figure. It would have cost the employer $70,000 for this infusion a month at the system level, at the hospital level, and we were able to get it at the home care for less than $10,000 a month. So not only this was an amazing experience for the patient, right? And I'm so proud of the team that worked to help her. But then the employer saved an enormous amount of money. So we have these examples. That's why I said before, please call us. You see something, you get a complaint, please give us a call. We're here to help, and we will help to do the best for you. So the final question we have is, how is the Alliance compensated for its innovative package of services? So all of these analysis, all of these discussions that we're talking about, the fact that we're coming all together, we're exchanging ideas, we are learning from each other. This is part of what we do every single day. So there isn't a specific a la carte price for packages of services. The Alliance gets paid a PPM. And then a modest percentage of savings. Our specific price is $8 per employee per month, plus a 1.9% of the savings that our contracts realize for you. And that price includes everything that Deb and I have been speaking about, and everything that we will be talking about for the remainder of the year as well. Deb, any parting words? I think these are the entirety of the questions that we got.
Great questions.
Great questions, right? And some of them very difficult. I love our employers.
Thinking about future webinars.
Yes, yes, indeed. Thank you, Deb. Thank you so very much. I hope everybody who attended found this helpful. You will receive an email from today's event. It will have a short survey. Please answer it. Your thoughts, your comments help us become better in the future. And also we will send you directions in that email. We will send you directions on how to apply for CE credits. I want a couple more things before we wrap up. I want to bring to your attention. First of all, Healthcare Transformation Awards nomination. This is the time of the year that we are asking for you, if you know of someone or if you yourself is assisting in changing, bringing innovation to healthcare and changing the healthcare ecosystem, making things better, easier, more productive, more cost efficient, please nominate yourself or the colleague you're working with for this award. You can submit your nomination on our website, from our homepage, actually, from what I understand. And the winners will be announced at our fall symposium and annual meeting, which will take place in person on October 25th, 2022. So please be sure to mark your calendar for that as well. Then, upcoming event, our spring symposium, and we're so excited for working. We've been working for a couple months on this already. So May 23rd is going to be our spring symposium. It will be an in-person event. And we have missed you tremendously. We hope to see you on our event. We will offer a hybrid event option as well, but we really love to see you. What I'm hearing every day is employers have missed the connection with other employers and with the experts in the field. So I think this, I'm expecting this will be a fantastic event. We will be doing breakfast and lunch. So we will have several opportunities to network throughout the event. It is on a Monday, so we're not going to have an event the evening before, a networking event the evening before, but rather we'll do breakfast and lunch. And we are working to put some stringent COVID-19 protocols in place. What we absolutely want is for all of us to be safe and for all of you to be safe. So, for example, we will be requesting masks. We will have encouraging, not requesting, but encouraging masks. We will have hand sanitizers, and our marketing team has come up with stickers for people to put on their name tags that indicate their comfort level regarding social distancing. So red, yellow, green. The first thing that I do when I see people, I just put out my hand to handshake. But the sticker will be able to tell me whether somebody's comfortable with contact or they would like social distancing. So as I said before, we will be talking about the RAND Hospital Transparency study, and in fact, the lead researcher from RAND will be here with us. We will talk with the CEO of Indiana's Employer Forum. The Indiana Employer Forum is her name, and she has done an amazing job, keeps doing amazing things, bringing more and more tools to help employers look at percentages of Medicare, look at the cost of hospitals, look at the profitability of hospitals. So we'll have a good discussion there. And then a session that's very near and dear to my heart, we will talk with employers about fiduciary responsibility to their plans. We will have a group of very knowledgeable individuals. I want to say that today, this afternoon, I'm starting my training on fiduciary responsibility of self-funded plans with that same team, and we will bring them to help us with this and also answer questions. We hope to see you there, and also then, we have a lot of events in May, and I know many of our partners are doing May events. But on May 4th, Everside Health will be hosting an event at the Edgewater on direct primary care. I'm hoping, I definitely will be there, but I'm hoping to be able to talk with you for a few minutes about direct primary care. I don't want you to think that I forgot all about direct primary care. This is still the biggest innovation that we can bring, independent primary care providers, biggest innovation that we can bring to our markets. It is a very near and dear topic to my heart. And we will be featuring employers that have actually done this. Lastly, I am very involved with WCHQ, their obesity work group, and we will be hosting an employer-specific webinar on June 8th around the disease of obesity and what physicians, specialists are recommending and what employers are doing for this very profound disease that we all need to recognize as a disease stage, and we need to help each other and our patients manage this. So with all this, that's it from us today. I want to thank you again for the privilege of your time today, and please have a great rest of your day. Thank you.